The event, which gathered health experts from the country's health sector, including Pharmaceutical System of Africa and Association of Pharmacies, aimed to provide fitting consultative document for a doctorate of pharmacy at the country's higher learning institute. The Director of Pharmaceutical System of Africa, Dr. Leon Matowe, highlighted the need for the Gambia to mobilize concerted efforts in producing more pharmacies, citing its importance in the country's health sector delivery.
We are here today, not just the curriculum development, but to indoctrinate ourselves on the importance of pharmacy and pharmacy programs in the healthcare system. Of all the expense in a health system, and the doctors will recognize that, 70% is on pharmaceuticals, it's on the products. And if the products are not managed well, we are not doing any service to our money.
Representing the Vice Chancellor, the Provost of School of Medicine and Allied Health Sciences, Professor Gabriel Ogun, cited some of the challenges faced by the School of Medicine.
I don't want the trouble I face now in the School of Medicine to face anybody. It is tasking mentally, psychologically for anybody. But what I face now as a provost, we want to add 2 more programs to the school: laboratory sciences and pharmacy. And those are challenging, lab-based, capital-intensive programs. I know that. Even medicine is cheaper to establish. We've introduced the dentistry program into the University of the Gambia. Everybody agreed at the beginning like this. But once the program started, everybody left the program for the University of the Gambia. Everybody took off. So at present, it's the university that grapples with the challenges of that program.
The Deputy Director of Pharmaceutical Services, Fatmata Samate, underscored the importance of pharmacies in developing national healthcare, citing growing number of registered pharmacies in the country.
According to the WHO standards, there should be about 4.5 healthcare professionals per 1,000 population. So with our population of 2.4 million, we are required to have about 10,000 pharmacists altogether. So with only 36 registered pharmacists in the country, you can see that we are far, far below the required standards in terms of numbers.
The Deputy Director of National Health Services, Mamadou T. Nyasi, underscored government's unflinching commitment in providing necessary assistance to the healthcare sector.
This is not the starting. We have done it with the Directorate of Nursing, where we have started a postgraduate training in nursing. We have done it with the clinicians, where we have started a postgraduate trainings for clinicians. And here we are today. We are about to begin a postgraduate training for Farm D. And next is laboratory. All is because of we want to strengthen the health systems. That's why we work very hard to secure a grant from the World Bank for the establishment of this training program.
As healthcare service delivery becomes a global concern, the government of the Gambia and partners are drawing mechanisms to strengthen the sector's delivery for the population. For GRTS News, this is Yerro Jallow reporting.